In this video, we demonstrate how to process autologous fat grafts using the Puregraft and Dermapose systems. Before beginning, collect the following: the fat graft, 1 sterile Puregraft 50 pouch, 1 sterile Dermapose system, 100 cc lactated ringers, and a sterile 50 cc syringe. Step 1. Transfer the previously harvested fat into the sterile Puregraft 50 pouch by screwing the luer lock syringe into the tissue wash port and injecting the fat through the port. For this demonstration, we've harvested 40 cc's of fat, though the Puregraft 50 pouch can purify up to 50 cc's at a time. This product also comes in a larger size that can process 250 cc's of fat at a time. Once all of the harvested fat has been transferred into the pouch, we move to step 2. Wash the fat with lactated ringers. To do this, draw up 50 cc's of sterile lactated ringers into a luer lock syringe. Screw the luer lock into the tissue wash port and inject the lactated ringer solution into the pouch. We use a 50 cc syringe for efficiency, but this can be done with any syringe that has a luer lock. Once the syringe is empty, detach it from the tissue wash port and gently agitate the Puregraft 50 pouch 2 to 3 times to mix the fat and fluid. Lay the pouch on a flat surface to rest for 2 minutes. After 2 minutes, it's time for step 3. Drain the wash fluid. Attach an empty luer lock syringe to the drain port of the Puregraft 50 pouch, and with the pouch upright, withdraw the wash fluid. We do this slowly, at a rate of about 2 cc's per second, to avoid collapsing the pouch. Note the color of the extracted wash fluid, which contains blood, tumescent fluid, and oil, contaminants that are removed during the wash steps. The remaining fat inside the pouch appears more golden yellow. Fat is not easily pulled through the drain port. Note that some air is drawn into the syringe once the fluid has been drained off, but the fat appears to remain in the pouch. Discard the wash fluid and move to step 4. Repeat the wash steps. Draw up another 50 cc of sterile lactated ringers into a luer lock syringe. Screw the luer lock into the tissue wash port as before and transfer the lactated ringer solution into the pouch. Once this is done, detach the empty syringe. As before, gently agitate the Puregraft 50 pouch 2 to 3 times to mix the fat and fluid, then lay the pouch on a flat surface to rest for 2 minutes. After 2 minutes, drain the wash fluid by attaching an empty luer lock syringe to the drain port of the Puregraft 50 pouch. With the pouch upright, withdraw the fluid at a rate of about 2 cc's per second. After the second wash, the fat appears golden yellow. Discard this wash fluid, and next, we'll direct the graft towards the tissue port. Direct the plastic slider on the Puregraft 50 pouch towards the ports at the bottom of the bag. This will direct the fat and any remaining wash fluid towards the ports. Drain any remaining wash fluid through the drain port and discard it. Now, we are ready to transfer the fat graft from the Puregraft 50 pouch into the Dermapose system. The Dermapose system contains 2 syringes. The outer one is a 50 cc luer lock syringe, and housed within this there is a 30 cc syringe that we'll highlight later. Screw the luer lock of the Dermapose 50 cc syringe into the tissue wash port. Pull back on the syringe and draw the fat graft into the 50 cc syringe. We take care to direct the tissue in the pouch towards the port in order to prevent fat graft loss and maximize yield. As the fat graft is drawn into the Dermapose system, it can be helpful to adjust the plastic slider on the Puregraft pouch, using it to direct the tissue towards the ports. Once the graft has been drawn into the syringe, detach the Dermapose system from the Puregraft pouch. Finally, size the fat. First, cap the Dermapose syringe with one of the orange caps that's included in the package. Note the position of the demonstrator's fingers. With the forefingers supporting the flanges of the 50 cc syringe, the thumbs push down on the outer ring flange of the 30 cc inner syringe. This draws the purified fat through the 800 micron filter and into the 30 cc syringe. The 30 cc syringe is then unscrewed from the Dermapose 50 cc syringe. We have about 15 cc's of purified fat from the 40 cc's that was harvested. The graft material can now be transferred to 1 cc syringes for grafting using the provided female lure-to-lure adapter. The purified fat is evenly sized and ready for grafting.